As we go forward for mayor of the city of Winnipeg, my good friend Robert-Falcon Ouellette is stepping up to make sure something happens for the people in the city. I acknowledge today a good Indian summer day. The sun is out, leaves are turning. A change is coming, I sense. This change will bring about better things, hopefully, for the city. And the mayor should be an integral part of that circle of life. With that, I'll say a few words in my language for prayers and blessings. I thank you all for being here and for acknowledging me as a veteran, First Nation veteran and elder. Hangishamantu. Biminakondano magizigak. Kanganina igunta singi kendazi. Ibega gwajimendastisha wenimiang. Mauget kamekap masyang. Mama nanake. Kinagugap matak. Nanakondane suji chakwimagak. Wegigitwen. Weaguitin. Wegi mama nanke. Kinagoga niugatiot. Kuskyo we. Kap masyot. Awe siyak. Sinesyak kinagaguna nakuntan. Esikyan daman ganin. Migwes hindi kit manong gumagita gabo yot go ubimatazik. Gagwes makay no. Sidsata mo atanin na nisnabe sa minigwes. Meta manakikituan o magizigak. And the suntani mak waba ng shago ng gabia ng piet ng mamanan ka izis. Pinis na negasyotes ang gisyaman to. So when I miss nam gisyaman to. So when I miss nam gisyaman. So when I miss nam gisyaman to. Miigwech, thank you very much.
No, come on, close. Well, Nimakoma Kantik Tensei Nimetane Atawapamtikuk, all my relations. Nous sommes ici sur territoire traité numéro 1. We are here on Treaty 1 territory, homeland of the Anishinaabe Nation, Nehios, Dene peoples. This is the homeland of the Métis Nation. C'est la terre de Riel, ici c'est la terre de l'Uriel, le berceau de la langue française, né ici sur les plaines. This is also the home of the Inuit peoples. This is the gateway to the north, and we must never ever forget that we all live here together. And we are all neighbors, friends, and relatives. Hey, hey. So thank you very much, Elder Melvin Swan, for your kind words and your prayers. And I'd like to thank each and every one of you coming out here today to hear our words. Today we are announcing our plan to tackle one of the most pressing issues impacting our city, Winnipeg, the addictions crisis. To build the city we all want, we need to address one of the root causes of crime and homelessness in our city. So let us have the courage to talk about and really address addictions. As a result of the addictions crisis, Winnipeg has seen a dramatic increase over the last 3 years in crime, overdoses, and death due to drugs that have overwhelmed our paramedic and firefighter personnel and has tied up our police with countless calls. Addiction impacts every asset of our life, and it makes us nervous to take the bus, makes us avoid certain areas of our city, and even makes us feel unsafe in our own backyards. And that's here in Canada, if you can believe it. Addiction is a mental illness and must be treated as a public health issue, not a criminal justice issue. Let's be clear. In Winnipeg, addiction is a public health emergency. There is a drug problem in Winnipeg that we must solve, and all options need to be on the table. The city is at the forefront of this public health emergency and should take the lead to solve it. And as mayor, together we will work with community organizations, the province, the federal government, Indigenous governments, and everyone and anyone to actually address this issue. To start, we need harm reduction and sharing a way forward. We need to move addictions out of the back lanes and parks and let addicts know that there is a way forward through treatment and support. In Manitoba, there were 407 overdose deaths in 2021, up from 387 in 2020, both record amounts. Last May, 23 overdose deaths were reported in Winnipeg over a 3-day period. And while the number of deaths is staggering, we must remember that for each death, there are hundreds of people, hundreds, across our city that continue to suffer from addictions that need our help. Our work should begin with harm reduction, and to do so, we need to move addictions out of our back lanes and our parks. Working with community organizations like the DCSP, with Vinnie Lilly, we need to reduce deaths and provide the potential for needed intervention. At all times, we must be able to show the addict where there is a way out, that treatment is available, and a better life is possible. So, at a very minimum, the city should set up a supervised consumption site, which it has the authority to do. Calgary has seen success in offering better healthcare services to people with addictions. Located in the Sheldon-Chumir Health Center, SafeWorks Harm Reduction Program provides a range of healthcare services and supports to individuals using drugs that improve their health outcomes and helps them transition towards recovery. I had the opportunity of touring this healthcare center where I had the chance of actually seeing this work in action. And I was surprised in how soon and how fast people could gain treatment, literally within the day, if they desired to have detox or recovery services. Far cry from what we offer here in Winnipeg. It is time that Winnipeg started offering coordinated addiction health services with the goal of harm reduction, reducing addiction levels and creating multiple entry points for long-term detoxification and treatment. Coordinated health services approach would need the buy-in of the Manitoba government. But at the very minimum, the city should set up a supervised consumption site, which it has the authority to do. And if it need be, the city must take the leadership role and be prepared to go it alone. Prescribed pharmaceutical alternatives is our next pillar. If our goal is to address this public health emergency, all options need to be on the table. While addicts in Winnipeg use several types of drugs, most overdose deaths are meth-related and are the result of bad supply, meth mixed with other drugs like fentanyl to increase potency. While it's essential for our city to have police target the supply of drugs, focusing only on cutting the drug supply can make the situation worse for meth users and addicts, pushing them to search out dangerous alternatives. It also increases crime in our city. As a public health emergency, it's time to recognize that addicts are using street meth because there is no alternative for them. If we want to reduce overdoses and overdose deaths, there is needs for prescribed pharmaceutical alternatives. This would require the buy-in from the Manitoba government. But both the College of Physicians and Surgeons of British Columbia and the federal government have been advising doctors that prescribing pharmaceutical-grade alternatives to street drugs as part of a comprehensive treatment plan or a standalone harm reduction strategy could better support patients and reduce their risk of overdose and help improve their health and reduce deaths in our country and our city. If our goal is to address this public health emergency, all options must be on the table. And immediate treatment is another pillar. Our goal should be to provide treatment when it is needed and to make sure no one is turned away when they ask for help. Too many times, people, when they require and desire to receive treatment, cannot simply find it in our city. And we see that everywhere, no matter where you are in our city. It's in all of the neighborhoods. The key to successful treatment is having treatment options available when someone decides to seek treatment. While the federal and provincial governments have committed additional funding for addictions treatment, there can still be months and months-long wait lists to access programs in Manitoba. We are committed to working with both levels of government to provide immediate access to treatment programs, including short-term voluntary detoxification programs and long-term inpatient treatment programs. Our goal should be to provide treatment when it is needed and to make sure no one is ever turned away when they ask for help. The other pillar is ongoing support services. Ongoing support services are essential and critical to the success of sober living. After treatment programs have been completed, patients require several supports essential to clean living to avoid relapse, including housing, life skills training, and on-demand access to support coaches and staff. An integral part of this final stage will require trained, compassionate coaches that are available 24/7 to offer monitoring and to support to maintain overall wellness and safety, to assist with daily living and successful returning to the community and or work, to help with motivation and guidance to set and achieve goals, to help with skills and strategies that will help overcome life's roadblocks and challenges, collaboration with treatment teams that ensure that goals are achieved, and to prescribe treatments that are being implemented, and ensure that the development of a realistic plan to improve various areas of daily living, including budgeting, educational planning, professional guidance, sobriety, stability, medication management, and overall physical and mental health. We are committed to working with community groups, addiction resources, and the Manitoba government to make sure that these supports are available after treatment. For these supports are critical to the success of sober living, and the city has a role to play in providing them. And finally, working with Indigenous governments. As mayor, the city will work closely with Indigenous governments and the federal government to ensure that First Nations, Inuit, and Métis peoples who need it have access to addictions treatments and all other essential health living support services. Indigenous governments have a very important role to play in preventing and treating addictions. Working with the city, together we can lift more Indigenous peoples out of the darkness that is addictions and build a stronger Winnipeg, not only for Indigenous peoples, but for each and every one of us. Because, as I said before, we all live here together. So, ladies and gentlemen, thank you very much for coming, and thank you to the people who have assembled here. I greatly appreciate it. I don't know if there are any questions from the assembled, but I would love to answer those. And I will leave you with one final thing. We need to have courage. Too often there is a lack of courage in politics because people are afraid of what one group might say and it might cost you an election. But at the end of the day, truths do need to be told about what is going on in our city. And we've been doing the same things over and over and over again, and it doesn't seem to have worked. So perhaps it's time to try things differently, to use a different type of leadership, one which is much more inclusive, that thinks about the overall health and has an overall vision for our city. And it's not to say that I have all the solutions, for I do not. But I believe actually if we work together, if we really work together, those who are in rural areas, those who are conservative, those who are NDP, Green, if we work with everyone from all walks of life, community groups, church groups, we can actually make a real difference in this city to ensure our long-term success, because we all want a city that we'd be proud of. Not a city known as Garbage Hill, but a city that we're literally proud to live in and that we dream of our children raising their families in, because it is a beautiful, thriving downtown, it is a beautiful suburbs, and we have green space, we have good urban planning, we have good urban development, and we have healthy, thriving individuals and a community who make up our city. So tapuya kikitwam, hai hai.